I have my VSI on. The scene appears safe. The NOI is difficulty breathing. I have one patient. I will call ALS if needed, and I will consider this fine. My general impression is a 36-year-old female patient sitting in the tripod position who appears to be having a difficult time breathing. Hi, my name is Colton. I'm an emergency medical technician. Can I help you?
Yes.
Okay. Have you fallen or hurt yourself today?
No.
Okay. At this time I can rule out trauma. What's your name?
Rachel.
Rachel, and where are you at?
At my house.
Okay. What year is it?
2013.
And what happened today?
I was jogging and just started having a hard time breathing.
Okay. My patient has an airway because she's speaking to me. However, she's having a difficult time breathing. So I'm going to go ahead and administer 15 liters of oxygen via a non-rebreather mask. And I'm going to expose the chest and listen to breath sounds. Go ahead and put that on you there. And Rachel, when I tell you, I want you to breathe in through your nose and out through your mouth, okay?
Okay.
Go ahead and breathe. And breathe. And again. And one more time. Okay. My patient's breath sounds are clear in all fields and equal bilaterally. Her skin CTC is pink, warm, and dry, and there appears to be no apparent bleeding. At this time, my patient is a high priority for transport. And Rachel, what is your chief complaint today? Why did you call us out?
I'm having a real hard time breathing.
Hard time breathing. When did this start?
About 20 minutes ago.
Okay. And anything make it better or worse?
Not really. Maybe just sitting forward.
Just sitting forward?
Yeah.
Okay. What's the quality of this thing? What does it feel like?
It just feels like my lungs are just really tight. It's just hard to breathe in and out.
Gotcha. And does it radiate anywhere?
No.
Okay. On a scale from 1 to 10, 10 being the hardest time you've ever had breathing, what number would you rate this?
Probably an 8.
An 8, okay. And you said about 30 minutes ago it started?
Uh-huh.
Okay. Any other signs or symptoms that I need to know about today?
No.
Okay. Are you allergic to anything?
Not that I know of.
Okay. Are you taking any medications?
I take albuterol.
You take albuterol. Okay. You have an inhaler?
I do.
Okay.
Mm-hmm.
And pertinent past history that I need to know about?
I have asthma.
Asthma? Okay. And what was the last thing you had to eat or drink? When and what?
I had lunch, a sandwich about 2 hours ago.
Okay.
And water.
Excellent. And events leading up to this illness?
I was just out jogging.
Just out jogging, okay. Can I have your inhaler?
Yeah. It's right here.
So I'll take this. And this is prescribed to Rachel Kirksick by Dr. Oakton. It is not expired. It doesn't expire until 10/10/2010. It is a meter dose albuterol inhaler. I'm going to warm it up in my hand, shake it up really good, and go ahead and place it back in here and check the connection. That looks good. I'm going to check my 6 rights at this time. I have the right patient, right medication, right dose, right route. I'm going to write the time and do the right documentation. At this time, I'm going to contact medical control. Medical control, this is Advanced EMT Yardley. I have a 36-year-old female patient who is experiencing a difficult time breathing after jogging. She has asthma and has a prescribed meter dose inhaler that is prescribed to her and is not expired. She is not taking any previous doses today. Can we have permission to go ahead and administer 1 meter dose with her inhaler? I do have permission for medical control to go ahead and administer 1 meter dose with the patient's inhaler. So Rachel, what I'm going to do, I'm going to take your oxygen off. I'm going to have you breathe out all your air, and I'm going to stick this in your mouth and have you make a tight seal around this. I'm going to count to 3. I'm going to push this down. I'm going to have you breathe in and hold in that medication as long as you can, okay?
Okay.
And then I'll put your oxygen back on.
Okay.
Okay? So I'm going to remove your oxygen.
Okay.
Go ahead and breathe out all your air. Tight seal around here. 1, 2, 3. Breathe in. Hold it, hold it, hold it. And I'm going to replace your oxygen. Okay? Then go ahead and record the time, the dose, and the route of that medication that I just gave. At this time, I'm going to go ahead and check a set of vital signs, okay? a respiratory rate of 16, and a pulse of 64. Skin CT is still pink, warm, and dry. I'm going to go ahead and check your eyes here. Just look at me. Good. Pupils are pearl. I'm going to place my patient on a pulse oximeter. Then go ahead and check a blood pressure. .130 by palpation, and then go 30 more. Patient's blood pressure by auscultation is 128/82. I'm going to go ahead and reassess my patient every 5 minutes because she is a critical patient. I'm also going to repeat my primary assessment, repeat my vitals, reassess my chief complaint, and check my trends. And at that time, check any interventions. You feel like that inhaler is helping you at all?
Yeah, it's a lot easier to
Good.
breathe.
You feel like that oxygen's doing okay?
Yeah.
Okay, great. And I will continue to transport high priority.